Hello, my name is Savannah Smith, and this is a fiber optic endoscopic evaluation of swallowing, or a FEES, that was conducted. Before the swallow, we can take a look here at the anatomy of some of the main players of the swallow. So let's get our bearings first. As we look at the image, we're looking at what the camera on the end of the endoscopic tube sees. So we're looking down to the larynx from up above. We can't quite see all of it, but here at the bottom, we see kind of the beginning of the base of the tongue, the very back part of the tongue. If you can imagine that as a landmark, it's a little bit easier to understand what exactly we're looking at. During swallowing, it retracts back to meet that posterior pharyngeal wall. At the root of the tongue here, we have the epiglottis, and it looks kind of like a leaf. So this is a flap of cartilage that moves back during the swallow and acts as a lid of sorts to protect the food or drink from going down to the larynx or the windpipe and into the lungs. It inverts to meet the arytenoid cartilages here, and it's in its upright position when we're not swallowing in order to allow air to pass through the larynx and into the lungs. So here, the trachea or the windpipe is this passageway here. This is for air only, not for food. The esophagus, which carries the food and drink to the stomach, is located posteriorly here, and you aren't able to see it right now. So let's go forward again over here to our glottal space where we see the passageway for air to and from the lungs. We can see the true vocal folds here, and they're also called the vocal cords. They are open when we breathe, and they come together and close during swallowing and speaking. So they produce sound when they come together and vibrate as air passes through them during exhalation. So over here on the outside of the true vocal folds, we have the vestibular folds, and these help to close off the trachea during swallowing. So next we have this area here, which are the aryepiglottic folds. This makes the lateral or the side walls of the laryngeal vestibule. So now let's go ahead and take a look at the swallowing of a liquid. This is going to be a milkshake. So here we'll see them take one swallow and then a few successive swallows. Okay, and we see that epiglottis moving forward to protect the larynx there. Or to protect the trachea. And then we also see the vocal folds, the vestibular folds. Let me see, there we go. Kind of moving back out to open the trachea because the swallow is done and it's now time for breathing. So we don't see any residue of the leftover milkshake, which indicates this is a normal swallow, and the entire liquid bolus is entering the esophagus as it should. Do we have any questions?
Hi, so I'm the patient. I'm Kiara, and I have a couple of questions for you. So why can't we see the esophagus?
Good question, Kiara. So at rest, the esophagus is closed. So there's a sphincter or a ring-shaped muscle called the upper esophageal sphincter. And so that senses when food or drink is coming toward it. And when it gets a signal, the sphincter relaxes and opens. So the food can enter the esophagus. Otherwise, it's closed and you can't really see it.
Oh, okay, that makes sense. What happens if food or liquid goes past the vocal folds?
Yeah, so this can happen sometimes, and it may feel like food is going down the wrong tube because it is. It's called aspiration. And so when this happens, your body might sense that the food or drink is going down the wrong way, and will trigger a cough to clear it from the trachea to protect your lungs. And if it doesn't clear it, unfortunately, the food or drink may go into the lungs and potentially cause pneumonia.
Oh, wow. Okay,
Mhm.
so why can't you see what's happening on the camera during the moment that I swallow?
Yeah, so this is because during the swallow, the walls of the pharynx come together to contract and to propel the food or liquid downward. And so the walls kind of close in on each other in that moment that the swallow is happening, which makes it difficult to see exactly what is happening in the moment, but we can take a look and see if there's any residue or anything left after the swallow.
Okay. So why does that big part on the bottom of the screen move?
Sure, yeah. So what you're seeing there is the esophagus. You can see it here on the screen. And so um, it has a huge role in swallowing because it inverts back and to protect the airway. So whenever we swallow, that's going to kind of completely move forward.
Oh, got you. Okay, last question. I heard of the modified barium swallow. Why did you use the fees instead?
Yeah, so we know that a fees may be better for someone if they don't want to or they're not able to be exposed to radiation or barium. Different foods and liquids can be used with the fees, and you get a direct view of the larynx and the pharynx with that little camera. Also, the fees is more portable and it is less expensive.
Okay, thank you for answering those questions.
Thank you. Are there any other questions?
Yeah, hi, I'm Kendall. I am Kiara's mom. And so I just have some questions. This procedure, does it hurt?
So typically this procedure won't hurt. It involves putting a small diameter endoscopy tube into the nose. So you'll likely notice that it's there and it may be uncomfortable. Topical anesthesia like a spray may be used for people, and it was used for Kiara. It's typically used for people that are medically fragile or children, or maybe people that don't feel as though they'll be able to tolerate the tube. But clinicians are usually pretty well trained when conducting the fees, and they know how to spot any adverse reactions.
Okay. And so you said, I think you said this, but where does the scope go? It goes through the nose, not the mouth.
Yeah, that's correct. So it's inserted through the nose and it leads into the pharynx, and it has a tiny camera and a light attached to it. And it kind of sits right above that epiglottis, that leaf-shaped thing that Kiara asked about earlier most of the time. And so we can get a good view there. And it can kind of be moved downward or upward as needed, depending on what we're looking at.
Okay. And I was wondering, I feel like in the image that you showed, I saw some things that kind of looked like cysts. Is that what those were? Are those dangerous?
Yeah, they're actually not cysts, but those are the arytenoid cartilages, and they help to move the vocal folds. And they look just right for a Kiara, but they do kind of look a little bit cyst-like and kind of bulbous, but those are just the cartilages in there.
Okay, okay, that's good to know. Thank you.
Of course.
Hi, I'm Kiara's sister, so I just have a couple more questions. Um, what kinds of things did you give her to drink for this procedure?
Sure. So during this procedure, liquids of different consistencies can be used. So this ranges from something as thin as juice or as thick as a milkshake. That's what Kiara had today. And it just depends on the patient's need.
Okay, and so I know you said the kinds of things that she would drink, but what kind of foods did she eat?
Yeah, so later on, we did give some food. And again, this depends on the needs of the patient. And it typically includes things such as applesauce or crackers. So Kiara actually got crackers.
And I know you mentioned the milkshake, but why was the milkshake green?
Yeah, great question. So food coloring is often put into the food or the drink to help it show up better on the camera.
Oh, okay. Thank you.
Awesome. Thank you for your questions.
Hello, so I'm going to just point out some of the structures that are involved in the swallow. Okay, so from what you can see, this is the client's epiglottis, this leaf-shaped structure. And behind the epiglottis, or I should say in front of the epiglottis, is the base of the oral tongue. And now it's kind of hard to see. I'll play it in a bit, or I'll show you with the vocal cords in view. But these circle structures, they look a little alarming, but no worries. These are just the arytenoid cartilages, and these kind of help the vocal cords close and aid in in closing off the trachea. So no food or liquids go down into the trachea or into the lungs, which would cause aspiration. And that's a very bad thing. So let's see if I can get a better view of the vocal cords. So right here, you see this little space. This is the trachea. If you can see little lines, I'm not sure if you have that view yet, but this is the opening into the trachea. Let's see if we can see the vocal cords or the true vocal folds. That's a better view. I almost see it. Oh, if you see those little white lines, those are the true, ooh, okay, good, I stopped it. Those are the true vocal folds right there. And on the sides of the true vocal folds are the ventricular folds. And what else? Yes, and the space between the true vocal folds is called the glottis. So let's look at an actual study. Our client here is going to swallow some juice, some applesauce, and then she's going to eat some Teddy Grahams, I believe. So take it away. So right now she's sipping some juice, and you saw that green liquid, that's just dyed green so we can get a better view of it. She swallowed that juice and there's no left over, there's no remnants. Let's see it one more time. And it's pretty quick. The fees is pretty hard to, or the fees is pretty fast. So that was her swallowing just a thin liquid or some juice. And next she is going to swallow some applesauce. And you can see parts of the bolus are around the epiglottis, the base of the oral tongue. That's just because the applesauce is thicker than just the juice or just a liquid, being able to swallow that right away. And right now she is eating some Teddy Grahams, and you'll be able to see in a second more of that food and how there's little pieces around the epiglottis, and that's just her breaking up and swallowing the bolus. Okay. Let me go back. Does anyone have any questions?
Hi, Kiara. I do actually have a few questions. I was the client that got this study done. My first question is, why does it look so bumpy?
That's a very good question. Let me, 1 second. I'm having technical difficulties. Let's see. So the reason it looks so bumpy is because what you're looking at are called the vallate papillae, which contains our taste buds. Enlarged vallate papillae are usually not a sign of concern and can be caused by allergies or irritations from certain foods or chemicals.
Interesting, thank you. And so what is that U-shaped structure that you were kind of showing in the video?
Of course, that U-shaped structure is called the epiglottis, and that helps cover the vocal folds and make sure that no food goes down into your trachea and into your lungs to where you'd aspirate.
Okay, and so why were there 3 different types of food or liquid used for this study?
There were 3 different types of food and liquids because we wanted to use foods and liquids with varying textures to observe how the patient is able to swallow or how they're able to tolerate each texture of liquid or food.
Awesome, thank you. And so another question, why would someone even need a fee study?
Of course, so someone would need a fees study if they were experiencing difficulty or pain while swallowing foods or liquids.
What's it called when someone has trouble swallowing? Is there like a clinical name for that?
There is, it's actually called dysphagia.
Oh, okay, cool. Thank you.
Of course.
Hi, I actually have a question. I'm Savannah's cousin, and I just had a few follow-up questions. Are there any side effects of FEES study that I should look out for?
Yes, well, in some patients, the study can cause a nosebleed or sometimes discomfort. And then in some, it could cause gagging or vomiting and some brief airway closure, which is called a laryngospasm. And then lastly, aspiration in some patients.
Okay, good to know. Why did you put green food coloring in the applesauce, juice, and Teddy Grahams again?
Of course, it's so we're able, the food and the liquid is more visible, just showing you exactly how it works and where it goes, just so you're able to see it better.
And does it hurt to have the FEES completed?
It's not painful, but it may be a little bit uncomfortable to have a tube travel down the pharynx into the larynx. But often we use a numbing agent or anesthesia, and we spray it into the nose to prevent as much discomfort as possible to the patient.
Oh, okay. Thank you.
Mhm. Any other questions?
Yeah, hi, I'm Kendall. I am Savannah's mom. I was just wondering, is there another way that you can assess possible swallowing issues in patients, or is this the only way?
No, there is another way. It's actually called a modified barium study, or MBS.
And so what exactly is an MBS?
Of course, so the modified barium study uses X-rays to view a swallow and the structures and muscles used for swallowing.
Okay, so I guess what's the benefit of using the FEES? Are there pros of a FEES study?
Of course, so the FEES does not expose the patient to X-rays and can be completed or conducted outside of a hospital setting.
Oh, okay, that makes sense.
Mhm.
Thank you.
Of course. Any other questions? No? Okay. Did I stop it? Did I pause it? Yes, I did. Did I?
Okay, so my name is Rachel Manning, and I am the speech language pathologist that completed this modified barium swallow study. So what we'll do is we'll watch the study, and I'll explain to you what's happening in the study, and then I'll take any questions. So I'm gonna play it. All right, so what's happening now is the cracker that Kendall is eating is starting off in the mouth, where Kendall's chewing it using her teeth and her tongue. Next, she swallows it, and the food passes through her nasopharynx, which is, let me see if I'm going to show you. Her nasopharynx, which is right about here, into her oropharynx, which is here, into her laryngopharynx, which would be down here. The cracker then passes the hyoid bone, the epiglottis, and the vocal folds, and moves into the esophagus. So we can finish watching that. So in this study, we see that Kendall takes 2 swallows. So the second swallow, the cracker goes through the same stages as the first one. So we'll watch it one more time. I know it was pretty fast. So there's swallow 1. And there's swallow 2. All right, so what I'll do now is I will take any questions.
Yeah, hi Rachel. It's me, Kendall. Good to see you again. I just have a few questions. So what is that dark black part?
So that dark black part is actually the cracker itself. So that's the food that you are swallowing.
Oh, okay. I mean, that makes sense. Okay. Um, is it normal to take 2 swallows to finish the cracker like I did?
Yeah, so swallowing the number of times to swallow a cracker being 2 is not much of a concern. You know, sometimes the cracker can get stuck within your mouth and you just need to get another swallow to get it down. So that really wasn't much of a concern.
Okay. And so in that image, where are my vocal folds exactly?
So that's a good question. Let me show you. I will circle them so that you can see. So your vocal folds would be this slightly darker area right between this lighter area down here. So it'd be right around here.
Okay. So that's the part that we wanted to avoid.
Mhm.
Okay. Can you see my esophagus in this image?
So your esophagus starts right down here, and then it goes down a little bit further. So we do get to see a bit of it.
Okay. And so from these images, can you give me a diagnosis?
So what we'll do is I'm going to take the time to look over this with the radiologist and your doctor that ordered this study. And once we review it all together, we'll be able to give you a diagnosis.
Okay, that sounds like a plan. Thank you.
Any other questions?
Yeah, so I'm Kendall's son, and I just had a couple of questions. Did my mom aspirate at all?
So there was slight aspiration. So let me clear this. So there was a slight aspiration in between the first and second swallow. So what we'll do is we'll examine that as a team, and we'll determine if it was of concern.
Okay, so what if my mom aspirates at home? Like, how can I help her?
It's a great question. So if she aspirates at home and she's coughing during it, so what you'll want to do is you'll want to encourage her to continue coughing. If she's unable to cough, her airway might be blocked, which would warrant an emergency. So you would have to call 911 in that case.
Okay, gosh. And does my mom need any further testing?
As of now, she doesn't. But once we review it as a team, we'll get back to you on any further steps.
Okay, thank you.
Any other questions?
Yeah. I am Kendall's aunt, and I have just a few questions. So, will taking smaller bites kind of solve Kendall's problem or help her out?
So smaller bites could help, but it might not be a long-term solution. That would depend on the diagnosis, and we would be able to move forward with the proper diet and which types of food and textures to avoid and move forward with.
Oh, okay, interesting. Thank you. So, does the radiation from the X-ray for this study, does that hurt her?
No, so the radiology would not have any lasting effects. It's kind of the same as getting any other X-ray. So it's just a normal radiation amount from the X-ray.
Oh, okay, awesome. And one last question. Why couldn't we really see past her shoulders on this view?
Yeah, so that would be due to the positioning of the study. So the way we took it was we took it from the side angle. So once we moved past the throat and neck area, we ran into the shoulders. So that is that dark black spot that you see down there. That's the shoulder. But we were able to see everything we needed from this view. So it wasn't of concern that we stopped at the shoulders.
Oh, okay. Awesome. Thank you for answering those questions, Rachel.
Yeah, of course.
Okay, hi guys. My name is Kendall, and so we're gonna go over Rachel's modified barium swallow study. So to start off, I'm just going to point out just some of the structures before the swallow begins. So here we can see the oral cavity. Let me go ahead and annotate this. Okay, so right here we see the oral cavity. This is where Rachel was, of course, chewing and beginning that first phase of the swallowing process, that oral phase. And then we'll see the liquid or the food, what I'll refer to as a bolus, transition back into the oropharynx, and that will initiate like the actual swallow down into her pharynx, or what we more so know as the throat. So we'll see that kind of propel down her pharynx. And then just to point out some other structures, we'll see this little guy here, which is the epiglottis, that's going to flip down and cover the trachea, the windpipe, and that will prevent any food or liquid from getting into the vocal folds here and down into further into the trachea, which connects to the lungs. And then as the swallow continues through the pharyngeal phase, it'll go down to this opening down here, which is the upper esophageal sphincter, and that connects everything down to the stomach. So we'll just kind of watch that swallowing process. Let me go ahead and erase all of these. Okay. So we first started off with just some liquid that she drank. And so you can see that there. We see that the epiglottis folds down, and it covered the vocal folds. We do see that there is some residue after those swallows, but it doesn't seem to penetrate down into the trachea past the vocal folds. And then again, for this next swallow, we moved into chewing some nuts. So you can see again, there's some residue. And you see as the larynx elevates for that last part of the swallow, we see a little bit of that bolus that didn't quite go down into the upper esophageal sphincter fully. And then from this anterior view, we can kind of see it transition further down into that esophageal phase of the swallow. Let me get a better look at that. So this is pudding that she is swallowing right there. And we see there's some residue in the esophagus. And we see there's kind of limited motility as it transitions through the esophagus. Okay, so do we have any questions?
Yeah, I have a couple questions. I know you did the study on me, but I just had a few follow-up questions. What was that part that raised up and down?
Let's see. Let me go back to it so I can point it out a little better for you. So that part right there that raises up and down when you swallow, that is the epiglottis. And so that's the part of our swallowing mechanism that involuntarily folds down if everything is functioning appropriately. And that's to protect those vocal folds in the trachea to prevent any food or liquid from entering and causing that aspiration where it penetrates into the lungs.
Okay, that makes sense. And why did it look different when I swallowed the liquid versus the pudding and nuts?
Yeah, so we made sure that we swallowed or had you swallow a variety of textures so we could observe the different consistencies to see if there were any certain textures and viscosities of foods and liquids that were appearing more difficult to swallow effectively. So we saw when you swallowed the liquid, it traveled down your pharynx a lot more easily than the thicker liquids did. There was some residue, but not much. And so it looked a little differently because it looks like it wasn't traveling as quickly. The motility was a little different as the foods became thicker.
Oh, that makes sense. Why did you have me face sideways and then forward?
Yeah, so typically when we do the modified barium swallow studies, we start with the lateral or side view, and that just kind of focuses specifically on the pharynx and the trachea, and kind of gives us a really detailed look at that part of the swallow. And then since we saw some motility difficulties with the esophageal phase, the anterior view kind of showed us more in depth that process and what was going on there.
Okay. And where's my hyoid bone? I know it's somewhere around here, but where is it on there?
So your hyoid bone is going to be right near your, sorry, let me get an annotation. Okay, I can't figure out how to annotate. So it's going to be kind of near where the epiglottis was. In that area, you can see kind of a darker part, and that elevates. There's a little piece there that elevates when your swallow's initiated. I can't figure out how to annotate it. That's
okay,
where
that
the
makes
thyroid bone is.
That's all right. I think I could see it because you already pointed out the epiglottis, so I could see that there.
Well, perfect.
There.
I'm glad that helped.
Yeah, so I'm glad I asked about that first. That was good. And I just have one more question.
Sure.
You kept saying there was some residue left over. What exactly did you mean? Did I not swallow everything?
So you technically swallowed the majority of the bolus, but sometimes when we swallow some things, we just have a little bit of leftover. So it's just some residual liquid or food left over in our throat. And you mentioned that you feel like you have heartburn or reflux, and that you cough a lot when you eat. So sometimes that residue can cause some of that. So it's nothing too concerning. And this definitely provided us a lot of insight into why you do feel that reflux and do feel the need to cough every once in a while when you eat.
Oh, okay. Then that makes sense. Thank you.
Sure. Are there any other questions?
Hi, I am Rachel's aunt. I'm sorry, my face is very bright right now, but I hope you can still hear me. So I know this is called a modified barium swallow study. What is barium?
Yeah, that's a great question. So barium is this like dry powder type substance that we mix with the different liquids and foods because it's a contrast material. So it can appear, it appears black in the images of the X-ray. And so that just really shows us a good real-time view of the swallowing process in these images.
Awesome, that makes sense. Thank you. Let me see. So Rachel complains of heartburn so often, and could you see that here in this X-ray?
Yeah, so this was definitely a helpful step in kind of understanding what's triggering those symptoms of heartburn and reflux. And so those symptoms are sometimes present when there's some residual or just some residue left over in the swallowing process, and when we kind of see like what we did with the liquid kind of not fully going down into the upper esophageal sphincter, and kind of when there's some when some of it starts to come back up. So this will help us understand kind of what's occurring when we reach that full esophageal phase in the swallow.
Okay, awesome. Thank you.
Sure.
And one more question. So Rachel's primary care doctor said that you would either do a FEES or this modified barium swallow. So why did you decide to do this one?
So this one is really great when we really want to see each of the three phases of swallowing. And since she did have those complaints and symptoms of that kind of gastrointestinal issues with the esophageal phase, this was a good choice just to kind of see what's happening in that process.
Awesome. Thank you, Kendall.
Sure.
I have some questions. I'm Rachel's sister, and I'm just wondering, what the process looks like after this evaluation.
Yeah, so now we'll kind of take these images and I'll review and interpret them further with my team, and we'll just kind of identify if there's any specific diet modifications or maybe like pharmacologic management that we should do, or any specific treatment recommendations that we should implement. And we can also see if there's any further assessment or evaluation that we want to do. So we'll just kind of take these images and review them a little more and figure out our next steps.
Okay. So it looked like there was a large mass in her chest when you showed the view from the front. Should I be concerned?
Let's see what that was. Are you talking about, yeah, this part, that little black mass?
Yes.
Yeah, so that is actually just the food traveling down her esophagus. So that was nothing to be concerned about. And it was just the barium working and showing us that process of the swallow.
Okay, that makes me feel better.
Yeah, good.
So what can we do? What can we do for Rachel?
Yeah, so we can discuss a little further, maybe some compensatory strategies that we can do and see if there's just any improvement to her symptoms while we continue to take a more in-depth view of the motility of the esophagus and see if an examination further of the esophageal phase kind of provides us with more detailed information.
Okay, thank you so much.
Of course.